A lot of folks asked what my area of interest was in this, and I thought I'd share a little bit because I think it's important because it helped to shape my approach in terms of this legislation. I want to thank the governor, Leader Dermody, and the commissioner, and more importantly, all of the staff in both chambers that worked on it for our behalf. Because for too long, people have been frustrated with health care. Many of you might know that I worked at the hospital prior to this as an x-ray technologist and was in radiology administration. And oftentimes when I was there, we would have questions about what care or what things were covered as opposed to what was the best approach to how to get things done in terms of preventative medicine and the approach that folks would have. And that was very frustrating because instead of focusing on making ourselves better, we oftentimes focused on what things cost. And in the current role as a legislator, we fielded quite a few questions with healthcare.gov when it first came up. And understandably, there was some concern initially. But thanks to our committees and our staff in the House and the Senate holding a series of hearings and information, it was very plain to see that the time has come for the state to take over this exchange. And we shifted to another set of questions. How best to serve the residents of the Commonwealth, those who needed access to health insurance. Nearly 400,000 individuals will have increased access and costs as outlined by the commissioner that would be significantly below what they're currently paying, thanks to the reinsurance program, which I thought the governor did an exceptional job of explaining, so thank you. We probably could have used you in our caucus, quite frankly. But all of those experiences and patient experiences shaped my own outlook, and it really came down to a couple simple things. What was the best course of action for the individuals who are currently on the system, and what's the best way to get access to care and while lowering costs? So thank you to the individuals in the Wolf administration for being willing to work with us in the House and the Senate and our colleagues in Washington, D.C. And thank you to the Trump administration for updating the regulations to make this even more achievable as we pursue the waivers and are able to drive those savings back into that reinsurance program. And thank you to Leader Dermody, because I know he fielded plenty of questions too in his own caucus regarding the program and the approach that we were taking. But regardless of how you feel about the status of things in Washington, D.C., we have a responsibility to govern here in Pennsylvania. And that's what this bill, I think, demonstrates more than anything else, was our ability to govern, work through a series of problems and questions so that we could arrive at a solution that would benefit everyone. And I think that we would all agree that saving money and increasing access to health care are not partisan issues. In fact, they're issues that should be our guiding light in how we approach and solve problems like these. So while we work together on more issues, and I'm sure this is just the first of many, and as the commissioner and the administration works through the implementation of this as we head to the fall of 2020 and the beginning of 2021 when it will be fully implemented, there may still be questions, there still may be some bumps occasionally, as sometimes happens when you work in government, but the truth is we're ready, willing, and able to continue to work together because that's what every Pennsylvanian deserves.